Hi Laura, we're going to start off by doing a respiratory assessment on you. Now, as the patient is doing 2 words per breath and her respiratory rate is at 30, we are going to try and keep our questions simple and yes or no answers. So do you have asthma? No. Do you have any other lung issues? No. Do you have any cardiac issues?
No.
Okay. So we're going to start off by having a listen to your chest, okay? We'll be listening to the top part of your lungs and the lower part, then you'll listen to your back as well, okay? Cool. Could we also just get you to open your mouth for me? Okay, we're just checking for any angioedema or any obstruction of the airway. Right. So deep breath in and out. And listen to the other side. Okay, I'm just going to do your shirt now. And the other side. Okay, and to your back. Slowly forwards. Alright. So what we were listening there for was equal air entry. We're listening for any abnormal noises. She does not have any. She has equal air entry. All lobes appear to be getting enough enough air, and there is no abnormal noises. So when the crew arrived, she started to calm down and breathe slower. We were looking for any patterns in her breathing, counting her words per breath, looking at how much respiratory effort she put in, if she was tripoding, positioning, if she had retractions, see if she had a bilateral chest rise and chest expansion. We're also looking for nasal flaring, and we're also looking for any patterns in her breathing, seeing if it's regular or irregular. So next thing we're going to do is we're going to have a tap on I'm going to tap on my fingers like this. I'm going to have a listen to your chest, okay? And the other side. First thing, I was listening for hyperresonance or hyporesonance, so if it's dull it would indicate that it's full of fluid. If it's hyperresonant it will indicate that it is overinflated or full of air, and as it is right now it was just normal. Okay, so next we're going to be palpating to check for any deformity, crepitus or inflammation. So I'm just going to feel along your collarbone and along your ribs and sternum. Is this okay?
Yep.
Okay. Is there any pain when I touch? Okay.
No.
Any pain?
No.
Okay. Anything?
No.
Okay. Next we'll also be testing chest expansion. So I'm going to put my hands here, and then I want you to take a deep breath for me, in and out, okay?
Yeah.
Breathe in. Yeah. Okay, so I had good bilateral chest rise. There was no deformities, crepitus, or inflammation. I want to have a look at your fingers to look for any tar stain that would indicate a history of smoking. I also want to check for clubbing in your fingernails that would indicate that you have a lung disease, okay?
Yes, it's fine.
Okay, sweet. So there seems to be no tar staining. Could you just do this for me? Yep, sweet. So I see a gap in between her fingernails, which is showing she does not have any clubbing. So when we first arrived, you were quite distressed and breathing quite rapidly. Did you have any tingliness around your mouth?
Yeah, a little bit.
And what about on your fingers? Did you feel any
Yeah,
tingliness
I
there?
felt a bit strange.
Yeah, okay. So now that you've calmed down, you've slowed your breathing down, that has gone a good way, correct?
Yeah. Yeah.
Okay, so I think it was just that you were hyperventilating.
Okay.
So you were breathing too much, and that is why you were getting the tingliness and you're feeling sick, okay? We will next be doing a musculoskeletal assessment. So just having a look here we can see that there's some swelling, redness, and obvious deformity. So are you in any pain right now?
Yes.
Okay, so we'll be administering some pain relief and then we'll be assessing the lump. We'll be doing a limb assessment, so we're looking for shortening or rotation. As you can see, there is no shortening or rotation right now, so next we'll be comparing distal baselines. So we're going to be taking a pulse on both sides. Okay, we're getting regular pulses on both sides, and then going to be doing a capillary refill. 2 seconds on each side. Next is we're going to look at the color and warmth. So both feet are warm and they both look perfectly normal. They are not cyanosed or swollen. So we're next going to move on to palpating the injury. Looking at seeing if she still has normal sensations on her feet. So can you feel this here? Does it feel normal? Okay, what about this? Okay, cool. Can you wiggle your toes for me? Cool. So she has normal movement, she has no altered sensation, no pins and needles or numbness. To do next is I want to feel your leg for any irregularities. Is this okay?
Yeah, that's okay.
Okay, so we're going to start at the bottom and just let me know if it hurts, okay?
Mm-hmm.
Okay.
Starting to get sore though.
Okay.
Yeah, it's getting quite supportive.
Okay, well I'm feeling a bit of crepitus
Yeah.
and swelling and deformity because we've got a bone sticking out here. So if you're palpating the leg, we'll be using the acronym PLUS-DISC. So we are looking for pain, loss of function, unnatural movement, crepitus, swelling, inflammation, signs of shock, irregularity, deformity. So what we have found through our assessments is that you are hyperventilating at the start, just possibly because of the stress of the situation and because of the pain. So we want to keep your pain under control. We want to keep you nice, calm, and relaxed. So we're going to be calling for some backup, some more powerful pain relief like morphine. We want you to keep using that and keep your pain under control. We also are going to be looking at splinting your leg and looking at long-term mobility because we've kept your joint integrity is okay. We're thinking it's going to be a pretty simple procedure to get it straightened out and get you walking again, rehabilitated.